All right, guys, good morning, one and all, and welcome to your introduction to mastery period and also your quiz master 2 for your physiology. Now, before we start, guys, pampagana muna tayo ng morning natin para at least now that you are in your mastery period, dapat tuloy-tuloy lang ang laban papuntang board exams. Okay?
Ito na naman tayo bagong simula. Huminga ng malalim, alisin ang kaba. Tapos na ang kahapon, pwede na yan itapon. Huwag lang ang mga aral, dapat yan ay ibaw. Katulong mo sa panibagong hamon. May paparating na bagong araw, pwede kang lamunin o pwede mong sabayan. Aral ang kahapon, pwede kanyang gabayan.
Kung ako sa'yo, tumayo ka na dyan. Huwag ka na magpahuli. Kami ay sundan patungo sa liwanag. Abutin ng tala. Pagkatapos pagkita sa mundo, pusong nagbabaga.
Upang lahat ay mamulat sa aking susulat. Parinig sa lahat ang aking ulat. Huwag kang mabahala, ang Diyos na ang bahala.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo. Sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, isusuko. Alam kong kaya mo. Sige lang sige, sige lang sige. Walang imposible. Walang imposible.
Nagniningning ang pangarap ng iyong pusong humihiling. Nakalimutan ang kahapon, sana'y dinggin. Sigaw ng aking puso, hindi susuko, hindi susuko.
Ilabas ang iyong pangarap, huwag mo yang itatago. Samahan mo ng sipag at tatag ng puso. Tumayo ka sa iyong silya, ikaw ngayon ang bida. Wala nang pipigil pa, eto na, eto na.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo. Sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo. Sige lang sige, sige lang sige. Walang imposible.
Napapagod, naiinip, natatawa, nagtataka, naiinggit, nagagalit, nangangawit, nabibigla, nalulungkot, nabubugnot, nahihiya, natutugso, nakukonsensya, nauubusan din ang pasensya, nasasaktan, nagmumura, pero lumalaban pa rin dahil natuto na.
Hanggat ako'y humihinga, sugod ang laban pa. Pangarap pabutin, kumislap tulad ng mga bituin. Sige lang, di ka nag-iisa. Sige lang, sige pa.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo. Sama-sama tayo hanggang sa
All right, and that was our introductory na video natin no, for you guys. Sige lang. So dapat lang guys kumapit tayo na mabuti. Mastery period yun na. I'm sure that you'll always be ready for your board examinations. And without further ado, we'll have Doc Broly for our introduction to your mastery period. Doc Broly, good morning.
Good morning, Chloe. Good morning, everyone. Let me share my screen. Okay, so welcome to your mastery period. The mastery period is the time between your main lectures and your subject pearls. Ang subject pearls, along with the buzzwords, that's basically our version of the final coaching. Okay, the mastery periods, yung pagitan ng subject pearls natin at saka ng mga main lectures natin. So what is done during the mastery period? During the mastery period, okay, this is the time that you do an active second reading of your handouts, ideally. Okay, kung hindi, that's the time that you address your backlogs. So this is the schedule that we have for you from September 17 all the way to October 9, yung mastery period niyo. 23 days. So around 2 days per subject, okay, in the following sequence. Physio yung start uli, yung pinakaunang subject ninyo, okay? Then legal med, juries, and ethics yung pinakahuli. Okay? So at this point, okay, let's go back to the basics kung paano mag-aral uli. We have 10-15-minute videos under the Top-Notch Study Strategies and Mentoring tab dun sa Top-Notch portal. Panoorin nyo lang guys, mabilis lang din naman to. Kung hindi nyo pa napanood before or you need to refresh yourselves, watch them. Effective versus ineffective learning strategies based on evidence. Okay? We have an infographic for that also. If you want the shortcut. Right now, at this stage, bigay ko na sa inyo, kailangan nyo talaga dyan. You have to do practice testing. You have to do elaborative interrogation. You have to do self-explanation during the mastery period. Okay? So yung practice test, they're actually more important than the handouts, than the main or equally as important actually. The main handouts, the main lecture videos will provide you with the knowledge. And then the practice test is basically the opportunity for you to apply that knowledge. Okay? The elaborative interrogation and self-explanation, this is what I want you to do when you do your second reading. Okay? So take a look ano yung nakasulat dyan sa elaborative interrogation. Basically, parang gumagawa ng flashcard sa utak mo. Self-explanation, basically you're connecting concepts in your head. That's why if you're able to explain or teach something, you remember it simply because you try to recognize concepts, connect them together in an orderly fashion for you to understand, for other people to be able to understand you. Okay? So those are the top 3. Yung pinaka ayoko mangyari, yung mga ineffective learning strategies I want you to avoid. One is passive rereading. Second reading does not mean rereading or passive process na babasahin mo lang uli very quickly yung handout mo, babasahin mo very slowly yung handout mo. That's not the point of second reading. Okay? It won't improve your grade if you do that. And evidence has shown that rereading won't improve that. So you have to do, paulit-ulit yan, active reading. So I'll discuss it later. Also try at this stage, tactical tayo, try to minimize your highlighting and underlining. It slows you down. Okay? It will slow you down. It won't really be remembered. Gusto lang ng mga tao nakikita may highlight yung mga handouts nila. Pero guys, hindi talaga siya nakakatulong. Unfortunately, we cannot give us a recommendation. Walang gagamit ng highlight sa top-notch. Masyadong talk. Yung nakasanayan ko during med school. Kailangan ko mag-highlight. Okay, kung kailangan mag-highlight, just highlight minimally. Meaning you only use one highlighter, not 2 or more. Okay, and you highlight, okay, talagang konti lang sa isang page, wag lahat. Okay, preferably pa nga, wag talaga mag-highlight eh. Talagang side notes, asterisks, checking, ganun yung mas okay pa. Okay, so do your practice test, elaborative interrogation, and self-explanation. Avoid passive rereading and avoid too much highlighting. Okay, there's a new video na nandito na rin sa Study Strategies and Mentoring tab. It's basically how to utilize flashcards properly, optimally as a top-notch student. So it was created by Dr. Kate Legaspi, one of the top-notch mentor, a graduate of UP Med. Okay? So gumawa siya ng video na to for everyone. It's just 10 to 15 minutes long. So, if you're going to watch the ineffective, effective learning strategies, panoorin nyo na yun sa kanya. Kasi may advice siya from the point of view ng isang estudyante. Okay? Estudyante dati sa top notch. Tapos, mahilig kasi siya sa flashcards eh. And I get the point. Remember, we have flashcards available. Those flashcards are based on previous board exam questions. Feedback ng previous board exam questions. They would actually be a nice complement to your handouts, okay, and to your practice test. So if you can utilize them, okay, use them. Habang nagla-lunch, habang nagbi-breakfast, habang nagdi-dinner, habang nasa CR, habang nasa biyahe if you're going somewhere, okay? That's the time you play around with those flashcards in your cell phone. Okay? So the Quizmaster session, so adok ang mga gagawin na bago ng top notch pag mastery period. So we have the Quizmaster 2 and the practice test 3. The Quizmaster 2 will be released on day 1 of each subject, 7 a.m. to 7:30, synchronous via online portal and via Zoom. Okay? While the practice test 3 will be released, okay, on day 2 of each, on day 1 of each subject, okay? But preferably you take the exam on the second day of each subject. Okay? Ano yung practice test 3, Doc? Hindi pa to na-release ever sa top notch. Bago to. These are practice tests based on the previous medboard's feedback. Okay? Created starting with your batch. Okay? The questions are actually already done. We are not releasing it yet because proofreading is currently being conducted. Masyado ng OC ang mga proofreaders niya. The proofreaders are made up by the members of the PrevMed team. That's also part of the media team. So that will include sina Mavi, sina MM, sina Louie. Certain top-notch teachers are also involved. Okay, the one listed dun sa practice test 3 authors ninyo. And there's another student that's currently a top-notch enrolled student, okay, na magaling talagang mag-proofread, that we also have gotten to proofread the questions. So, several layers ang checkers natin dito, okay? So, basically guys, hindi nila pwedeng gawin all 12 dahil pati yung top-notch student nag-aaral pa up to now. Okay? Kailangan din niya mag-mastery. So, ang plano is that we will release the practice test 2 subjects in advance. At least, we're going to aim to release as many as possible. As soon as matapos ma-proofread, release na. Okay? But realistically, sabi ko, we can only do 2 subjects in advance. And I think that's okay. Kasi, halimbawa, physio ka ngayon for the next 2 days. If I release it 2 subjects in advance, kahit sabihin mong, Doc, natapos na ako sa physio, gusto ko na mag-anatomy, at least naka-ready na. Okay? You don't have to print the practice test, guys. Baka nape-pressure kayo na, Doc, kailangan ko i-print yan. You don't have to print it. Probably, if I were in your position, I print ko lang talaga main handouts, yung flashcards, tsaka yung practice test. Okay, titirahin ko na yan talaga using PDF. Okay, kaya naman kasi kung tutuusin eh. Okay, hindi ka pa na-hassle sa pag-print. So that's the goal. Quizmaster 1, you do them on day 1. Practice test 3, you do them. Quizmaster 2, you do them on day 1. Practice test 3, you do them on day 2. Okay, 2 days per subject ang usually allotted. Now let's discuss how do you study as an average top-notch student and someone na medyo naghahabol, a little below average. So let's define first, ano yung average top-notch student ngayon, Doc? As of this, at this point, September 17, 2023, take note that most students, what we define as average, will have the following characteristics. This is based on our experience, based on the previous batches. Okay? Number 1, most of them would have finished with the main lecture videos. They would have followed the advice of watching the lecture videos and doing the main handouts. So most of them will be finished with most, if not all. So not necessarily all, pero most, sabihin mo more than 75%. Okay? A lot of the students, the average top-notch students, will still have some backlogs in the main handouts. Backlog here being defined as unfinished readings of the handout. Okay, unfinished sections of the handout, hindi pa nababasa. Napanood na nila yung video, pero yung parts na minsan wala video pero nandun sa handout, yun usually yung nagiging backlog ng mga student. And it's usually scattered. Hindi siya concentrated on just one or two subjects. Nakascatter siya. Okay? Most students at this point have also finished at least one practice test, and a significant percentage was actually able to do both practice test 1 and practice test 2. And then the average top-notch students would have attended most, if not all, of the Quizmaster sessions, okay, and the summary lecture. So yan ang ano natin, mean or median natin. So for this student, if you belong to this category, Doc, mukhang average naman ako, okay, na napanood ko karamihan, pero hindi lahat ng lecture videos. May backlogs po ako, nakapag-practice test naman po ako, Doc. Nag-attend naman po ako as much as possible ng mga Quizmaster and summary lecture. So if you're this average top-notch students, this is our recommendation, okay? First, you really do need to finish your remaining backlog readings. Ngayon, Doc, paano yung schedule? Gagawin ko ba yan isang bagsakan? Gagawin ko ba yan, sabihin mo, 2 hours per day? Paano po yung magiging tactics natin dyan? It's going to be very dependent kung ano na yung natapos mo tsaka kung ano yung subject na involved. Okay? So you need to coordinate with your mother goose or get a mentor. Ipapa-expedite na natin. If you want a mentor, wala ka pang mentor, okay? Dapat meron kang mentor within 2 days. So, pag hindi kayo nabigyan within 2 days, sabihin nyo sa akin, ako na yung mangungulit dun sa mga FGs ninyo. Troy, please give advice to the FGs. Pag nag-request ng mentors ang mga tao ngayon, within 2 days dapat meron na. Kasi kailangan nilang mag-coordinate dito. Okay? So, if you're this average top-notch student, try to finish your backlogs and do it in an expedited manner. Make sense of urgency na, okay, tapusin na natin within 6 hours or 8 hours itong remaining 20 pages, for example, lang handout na to. Subukan natin mabilis na tapusin. Kahit na wala na muna lecture video, tapusin na natin tong backlog na to. After that, okay, after you're done with the backlogs, you do a rapid second reading of the main handouts. When I say rapid here, second reading here, I mean it's going to be an active second reading and not mere reading. So I'll discuss later kung ano ibig sabihin yan. Always, religiously, para kayong pumunta sa simbahan, day 1 ng bawat subject, okay, remember, basically, ang schedule niya for mastery, you have 2 days allotted for each subject times 12. So approximately 24 days in total. So day 1 of each subject, you will do a QM2 at 7 a.m. to 7:30. Okay? And then on day 2, that's the time that we recommend. Basically, parang ito yung dessert nyo, ito yung panghimagas. Do your practice test from 8 p.m. to 11 p.m. Okay? So something to start each subject. Okay, Quizmaster, something to end each subject, practice test 3. Be disciplined in doing this if you're the average top-notch student, the one with these characteristics. Okay? Next. Doc, anong ibig niyong sabihin na huwag re-reading? Anong ibig niyong sabihin ng active second reading? What I mean by that is whenever you look at the handout, guys, don't stare at your handout. Okay? Talagang tatagal kayo. Never stare at the handout. Instead, you interact with that handout. Okay? You interact with yourself. Okay? Tanungin niyo yung sarili niyo habang binabasa siya. Okay. Halimbawa, meron itong baroreceptor reflex. Ano ba yung alam ko dito? So, baroreceptor reflex, pang-control ng BP, minute to minute. Baroreceptor reflex, yan yung mga may stretch receptors. Baroreceptor reflex, ito yung gagamit ng cranial nerve 9 or 10. Baroreceptor reflex, ito yung first line. Interact. You ask yourself, what do I know about this concept? Okay? Next is, paano ito itatanong sa exam? Okay? Develop your sense of smell pagdating sa ganyan. No? Baroreceptor reflex, nang malamang itatanong siguro to in comparison sa renin-angiotensin-aldosterone system, sa RAAS. Lilituin ako. O kaya baka tanungin yung Hering's nerve sa part na to. Okay? Naalala ko rin, may practice test dealing with this in terms of a clinical case. Ano nga pala yun? So, you get my point? That's how you do your second reading. Okay? You're not going to try and memorize during your second reading. During your second reading, you're going to basically talk to yourself, what do I know about this topic? How it can be asked in the exam? By answering that question, what do I know? How can it be asked in the exam? You have actively interacted with the material. It's going to be more retained. Okay? Now, there are some parts talaga that you really have to memorize. Ano ba, brachial plexus? I-memorize ko yan. Pero kasi guys, you have to be tactical here. Yung parts that you have to memorize, ang memory kasi natin, for some people who are very smart, they take a look, they're able to memorize very quickly. For some, it's a struggle. Ang nangyayari niyan, titingnan ko, ano ba itong brachial plexus? Okay, ganito, ganito, ganyan. And then I repeat, ganito, ganito, ganyan. And then, ang pinaka-idea niya, pahinga muna, and then mamaya, ano nga pala yung brachial plexus? Tingnan ko uli. Ito, ganito, ganyan. That's how you memorize. If there are certain aspects in the handouts that you have to memorize. Most people will just have to go back and take a look. Do not force yourself na 30 minutes, 1 hour na, minimemorize pa rin yung brachial plexus. Kasi chances are malilimutan din. Okay? So, most of the time, you really just have to, okay, quick, Command F ng PDF, Command Control F. Ano uli ang brachial plexus? Ganun lang. Okay? You be gentle on yourself. Okay? When it comes to memorizing. And you don't memorize everything in the handout, you'll die. Okay? You memorize only portions na alam mong, tingin ko posibleng lumabas to sa exam or kailangan ko to for my career as a general practitioner. So be tactical in what you have to memorize because you cannot memorize all and you shouldn't memorize all. Instead, actually much better than memorizing is that you interact. Ano yung alam ko dito, paano to itatanong sa exam. So ang magbabasa passively, wag highlight like a zombie. Okay? No to zombie highlighting. Okay? Actively read it. Okay? Dok, hindi ako nasanay sa ganyan. Ang style ko during med school. Ano talaga, highlighting, talagang rereading as if may osmosis, ma-absorb ko yung binabasa ko. Okay? You're going to struggle, but if you aim to progress and if you aim to grow, it's doable. To be honest, this is what I do actually ever since natapos na ako ng boards. Okay? Palagi ko talagang tinatanong, pag nag-aaral ako right now, ano yung alam ko dati dito, paano to pwedeng i-apply sa tunay na buhay? Okay? You're basically trying to identify the relevance when you do these questions. And you're basically trying to connect the dots when you answer these questions. That's why I'm a proponent for this. Naalala niyo kanina yung self-interrogation, self-explanation. Basically, yan yun Yan yung concept na yun What do I know? How can it be asked? Okay? So, again, yung flashcards will help in terms of memorization. Okay? Yung practice test will help in identifying how it can be asked in the exam. That's why main handouts, main lecture videos, flashcards, pearls, buzzwords natin, they're all integrated and designed to work together. Okay? Now, on day 2 of each subject, okay? 8 p.m. to 11 p.m. Kasi ang target ko palagi, 11 p.m. matutulog Okay, kapag mag-aaral yung estudyante for the boards. So do 1.5 hours to answer, about 1 hour to reflect and look at the explanation. Again, when you do your practice test, you have to do them properly. Huwag yung tatato mo yan na handout na 1, ano yung explanation, 2, ano yung sagot explanation, 3, ano yung sagot. When you do that, that's useless. You have to answer it 1 to 100. Okay, you have to score. Okay, you record your score. Then, when you look at the questions, you have to reflect. Bakit ako nagkamali? Ano yung iniisip ko at that time? Then, that's the only time that you look for the explanation. Ito yung explanation. Okay, gets. Number 2, bakit ako nagkamali o bakit ako tama? Ano yung explanation? Reflect. The process of reflection after each question when you do your practice test, that's the one that will boost your scores. Do not expect na, Doc, ang aral ko kasi sa Samplex parang med school. Ine-expect ko lilitaw uli sa exam. Guys, hindi lilitaw yan sa exam. Lilitaw, perhaps related concepts, questions na related dun sa tinanong, pero hindi yung exact question lilitaw. Ang repeat rate lang nila sa med boards for past med boards is 1 to 2%. Okay? Meron at meron, kahit sa visual, meron ng repeat questions na na-identify kami Okay? But it's not do your practice test with that expectation na mauulit yung questions sa exam. Mali yun. Masyadong med school style yun. Sa med boards, you do your practice test as a practice to how you will actually answer in the med boards. Okay, the process of reflection, why you will have the mistake in the particular item, you will learn from that mistake. Never to do that in the med boards will improve and boost your scores. They already did studies. The one that has the most significant impact in terms of improving student grades is the use of practice testing. In Top Notch, we have 4 practice tests lined up for you. Okay? Aim to at least do 3 siguro. Okay? 4 if you have more time. Okay? Kung kaya pa. Okay? But at least 3 practice tests. Okay? Next. What if, Doc, ako yung estudyante na sobra talagang daming backlogs? Yung a little below average, Doc. Hindi ako yung describe yung kanina with these characteristics. Finish of most, if not all, have backlogs, some backlogs, finish at least 1 practice test, attended most of the quiz master. Medyo po, ano, Doc, mabagal po talaga ako magbasa, unfortunately. I've also missed most of the lecture videos. And about 50% of the total number of pages of the main handouts, hindi ko pa po nababasa do. Okay? So with this, we have to adjust our targets and we have to adjust our tactics. So pag ikaw yung estudyante na talagang naghahabol, and this is the way we define talagang naghahabol, maraming masyadong na-miss na lecture videos, 50% ng total number of pages sa main handout, hindi pa rin nababasa. Target is not to do a second reading anymore. The target is to do just 1 good first reading of the main handouts plus utilization of selected main videos. You need to coordinate with your MG or mentor for help kung anong main videos do ang panonoodin. Okay? Given na naghahabol po ako. But something that I would recommend, ito guys this is my personal recommendation yung absolutely kailangan yung panoorin. You need to watch the Rebosa lecture videos. You need to watch the Rebosa lecture videos. Kahit naghahabol kayo, dahil yung mga cases na sinasite nila will boost your grades pagdating talaga sa exam. Hindi masyadong napapansin nyo kasi tingin nila, Doc, kumpleto na yung main handouts, may laban na kami dito, di ba? Yes. Pero yung points na ine-emphasize nila, Doc Rebosa, yung mga cases nila, will further boost your score, so you need to watch that. Next, another problem that I see here, yung biochem, students tend to choose Doc, kasi ang sinabi sa amin, maraming lumitaw doon sa Rubio handout, Rubio lecture. So yun lang yung mas pinanood ko talaga. Or Doc, mas enjoyable yung kay Ronnie Bats eh. So yun lang po yung pinanood ko, yung kay Rubio, hindi ko na pinanood, hindi na ako nag-enjoy. Unfortunately, nabigay ka talaga kay Prince Rubio yung mga topics na hindi namin type. Yung pre-med biochem, parasitology, then yung neurophysio. Guys, you need to watch the Rubio videos for biochem dahil lumilitaw yun sa boards. Yung pre-med biochem na sinasabi namin, yung mga org-chem, etc., lumilitaw sa boards. Kasabay, mas minsan pa nga, mas marami pa yung lumilitaw doon sa Rubio videos, Rubio handout, kaysa doon sa particular handout. Both will be asked. Ang trend noong 2020-2021, wala halos kay Ronnie Bats, karamihan kay Rubio. 2022, meron na parehas, pero significantly, mas malaki pa rin yung kay Rubio. So, while mag-aalay sa biochem, you need to watch both lecture videos and you need to read both handouts. Next, ano pa yung importante na lecture videos na hindi nyo dapat ma-miss? Probably, Pato, yung kay Kevin Elomina. Pag dinaanan nyo naman yung Pato lecture videos ni Kevin, basically, ma-highlight mo na rin, manonotes mo na rin yung entire handout. So, I will probably kahit nag-ahabol kayo, if you're this relatively underperforming student, okay, tirahin nyo pa rin yung kay Kevin Elomina. How about, Doc, yung sa physiology? Yung physiology kasi mahahabol natin yan pagdating ng pearls, pagdating ng buzzwords. Okay? So, probably, okay, if you're this type of students, okay, in my opinion, professional opinion, the Rebosa videos, the biochem videos, and the Pato videos, those are the most important and it had significant impact sa med boards nyo. Everything else, the other subjects, mahabol at mahabol natin kasi sa pearls at sa buzzwords. Mahabol din siya kahit paano pag natapos mo yung main handout. So you do a good first reading of the main handouts, okay? the target for this type of student, just one good first reading. So ano yung magiging second reading, Doc? Hindi ba nakakatakot na wala kaming second reading? The subject pearls and the buzzwords will now serve for this population as your second reading. Finish or not finish, October 10, 2023, drop everything for the pearls and buzzwords. Kahit for the average top-notch student, this rule also applies. October 10, 2023, drop everything. Concentrate on the pearls and buzzwords. Okay? For the student, okay? So, Doc, hindi kami magpa-practice test. Mag-attend lang kami ng quiz master, pero hindi kami magpa-practice test kung kami itong marami masyadong na-miss na lecture videos and handouts. Yes, don't do your practice test 3 yet. I would recommend that you do your practice test 3. Practice test 4, kung kaya, October 16 to October 19. So, after the pearls is done, doon nyo na lang siya i-schedule. Okay? And then, finally, kindly message me on Facebook if you need academic counseling. Doc, ako yung kausap. Hindi ko talaga alam, nababaliw na ako kung paano i-handle itong mga backlogs ko. Sobrang pong dami. Doc, hindi ko po talaga may fear anxiety. Pagtulungan natin, message me. I'll probably call instead of just chatting with you. Okay? So, pag-ayusin natin, guys. Huwag niyong soluhin yung problema na yan. Okay? So, some question and answer. Doc, kaya ba talaga yan? Talaga ba talaga 23 days lang ang mastery period? Yes, even during pre-pandemic. From 2016 to 2019, that's the allotted time that we have for mastery. So, hindi siya bago, kaya siya. Okay? Kayang-kaya siya for most students. Okay? Has it always been this way, though? 2 months, basically, ang preparation niya for the mid boards. Approximately 80 days. This has happened because of the shift in the scheduling by PRC noong 2016. From 2007 to 2015, ang time allotted talaga for the med boards is 3 months. Close actually to 100 days. They had the board exam in August. Internship finishes by May 1. So with that kind of schedule, the students have 100 days. Yun actually yung best. Yun tingin ko yung pinaka-optimal. Pag binigyan mo ang students ng 4 months to study exclusively, 5 months to study exclusively, you will think that they will have more time to study. But actually, hindi eh. Ang findings namin so far, pag ganun katagal, 4 to 5 months exclusive study time, a lot of those time is allotted for vacation, o kaya talagang they slow down. May adjustment eh. Parang nagka-cardio exercises. Pag nag-cardio exercise ka, hinahabol lang ng kain. So dito, pag binigyan mo yung students ng 4-5 months ng exclusive preparation time, okay, hindi sila mag-aaral ng 4 to 5 months todo. They tend to relax for several weeks and then talagang 3 months lang din talaga yung optimal na aral nila. Itong 2 months happened from 2016 all the way to the present. Kaya ba siya? Kaya pa rin. Surprisingly, nagagawan pa rin ng paraan. Okay? Right now, you're a little bit better kasi hindi siya saktong 60 days eh. Yours is a little bit around 80 days talaga. So, kaya. Okay? Bakit hindi daw 5 months ang program ng top-notch? I've heard noong 2022, 5 months. Yes, in 2022, we had a 5-month program for the October batch. But remember, since the internship will end July 31, okay, we basically, if it's a 5-month program, we have to start the lectures May 1, 2023. Ay, May 1. So just imagine kung halimbawa nag-facial lecture ako sa inyo ng May 1, mapapanood nyo ba while internship is ongoing? So naging feedback ng 2023 is, Doc, talagang mahirap mag-aral while we have face-to-face on-site internship. That's why a decision was made for your batch na umpisa na lang talaga yung program after internship. Yung PASCO also gave, sakto, when we made that decision, we declared that, I think a week or 2 after PASCO released APMC released a advisory to all the hospitals na dapat ang mga students mag-concentrate na lang sa internship during internship. They don't have parang, hindi sila dapat i-pull out for reviews. Okay, one internship is ongoing. So sabi ko, sakto lang din. Okay, yun naman talaga yung tama. Pabayaan mo mag-focus muna yung mga estudyante sa internship work nila during internship, and then tutukan mo na lang talaga na matindi after. Okay? So Doc, another question, Q&A, another FAQ. Doc, parang wala pa rin akong nare-retain up to now. Who? Okay? Sometimes it's very subjective yung wala kang natututunan eh. Minsan may natututunan ka man naman talaga, pero you're basically underappreciating yourself. What do I mean by that? Okay? You be objective. Okay, wala po ako natututunan. Let's be objective. You take a look, you record your scores in the practice test, and then you take a look at the results of your midterms. Obviously, if you're getting green, if you're getting scores more than 60% in the practice test, getting raw scores of more than 60, you're doing well. You're doing fine. Okay? If you see your practice test scores increasing from practice test 1 to practice test 2, you're doing well, you're progressing. So that's an objective, a way to validate whether you're learning or not. Ngayon, Doc, parang nag-regress yung practice test ko, bumababa ng practice test 2. Doc, naka-red ako during midterms. Kinakabahan ako, so it means I'm underperforming relative to my peers. Okay. Pag ganon, that's the time that you really have to seek counseling, whether from the mother goose, the mentor, or from me. So, you maximize. Okay? Yan yung susulitin nyo yung bayad ninyo. Gamitin yung mentor, tanungin nyo yung MG, tanungin nyo ako pagdating sa ganyan. Okay? So, also, it's a matter of attitude and perspective. Napansin ko kasi, very gung-ho ang mga students, which is good and bad at the same time. They aim to master the materials the same way that teachers do. So, they aim na, Doc, kung ganito kagaling si Ronnie Bat sa biochem, dapat ganun din ako kagaling. Kung ganito kagaling si Kevin Olomina sa Pato, the way he masters the material, dapat ganun din. Kung ganito kagaling si Lou Antonio sa surgery, dapat ganun din ako kagaling. Kung ganito kagaling si Gabby Flores sa pharma, dapat ganun din ako kagaling. Not possible. These teachers are concentrated only on one instead of 12 board exam subjects. And they've been doing it, most of them, for years. I've been teaching for 17 years. Dr. Lou has been teaching for close to 20 years. Okay? So they will have a different mindset and different level of mastery with the material. So what you should be aiming for is really progress rather than perfection. Am I better than my version ng August 1? Am I better today? Mas marami na ba akong alam compared during internship? Okay? Am I performing better than my peers based on the diagnostic midterm finals? Okay? So, yung progress na yun is what you should be aiming for. Don't aim for perfection. Don't aim for complete mastery, complete memorization. It's going to cause frustration. Okay? You aim to progress. So, you have to be gentle sa sarili niyo pagdating dyan. Another Q&A. Doc, I have anxiety and fear about the midboards. Ayoko bumagsak. Nakakahiya. Message me on Facebook Messenger, Enrico Paulo Banzuela. Not Enrico Paulo Banzuela 2. Usap tayo, will counsel you pagdating sa ganyan. Okay? Remember something? I like this quote. When Dr. Lou Antonio of Surgery was given an on-site lecture to our students, I think that was 2018-2019. Out of the blue, napareflect siya, and then sinabi niya to dun sa mga estudyante habang nakikinig ako. And this the way he opened up his lecture. You cannot be truly ready for the med boards until you are ready to fail the med boards. Pag-iisip kami. He didn't explain it. Pinabayaan niya kayo mag-isip regarding that. And I felt, tama. Okay? Tama yung na yan. You cannot be truly ready for the med boards until you're ready to fail. Not pass. Until you're ready to fail the med boards. So what does it mean? Okay? You do your best. Okay? And after a certain point, kay Lord na talaga eh. You take a leap of faith eh. Parang, gusto ko lang masabi talaga, Lord, ginawa ko na po talaga lahat. Ito na po yung apogee ng aking performance, apogee ng aking pag-aaral. The highest point that I can reach. The very best effort. Kunin niyo po ako ngayon, talagang masasabi ko with a straight face, ginawa ko na po lahat. Pag alam mong ginawa mo na lahat, naging mabuti kang tao, ginawa mo na lahat, naging masipag kang tao, hindi ka na dapat alam mo yon, strict sa sarili mo, mahigpit sa sarili mo. Okay? The results of the med boards are always better than what you expect. Classically, sabihin ng mga estudyante, Doc, binilang ko kasi 30 lang yung sure answers ko, alimbawa for this subject. Nagulat ako, mataas. Ang nakuha kong grade sa subject na yon, isa pa siya sa highest ko. Okay? Remember my MPL sa med boards? Remember them? Okay? That in top notch, hindi nyo lang napapansin, but we're actually over-preparing you for the med boards. That's the goal. The goal is not to merely prepare the students for the med boards. It's to over-prepare you for the med boards. Okay, and over-prepare you for general practice. Why do we have that mindset? Okay, bakit ang toxic sa top-notch do? If this is what you need to pass the med boards, when we over-prepare you, kahit hindi mo magawa yan, may backlog ka, may days na may mental health issues ka, that will still be sufficient for you to reach yung parang minimum kailangan pumasa sa boards. Papasa ka. Okay? So, I always believe that the more you sweat in training, the less you bleed in war. I always believe kailangan mas mahirap ang review, mas mahirap ang boards preparation kaysa sa actual boards. Kaya ganun dapat. Kasi parang sa tunay na buhay, pag ang training mo mahirap, ang actual practice mo mas madali na. Okay? The lessons that you're going to learn here in Top Notch will apply for residency. Okay? You think mahirap at ganito nakatoxic sa 3 months na to? Sa residency, you're going to do much, much more. It will prepare you. The handouts that you have here, you will be able to utilize that even for residency. Okay, more than what you expect. Okay, so just relax. Trust in the program that we have for you. Okay, trust in that program that we have for you. Okay, and be ready not just to pass the med boards but to fail. Have that mindset na I'm only going to be ready if I'm ready to fail. Meaning, I have done everything within my power. Okay, I have given my 100% effort. Okay? For those who have taken the med boards before, we're going to have an on-site and a virtual library available for you. Ito yung napag-usapan namin ng mga MGs and mentors. Kasi pinag-uusapan namin for the repeaters, ano yung pwede nating ibigay? Pwede ba tayo magbigay ng additional lectures for them? Pwede bang tutorials? Pwede bang on-site na exams? When we took a look at the schedule, sabi ko, masyadong defined na yung kailangan gawin ng mga estudyante. Masyado sila busy. So I think the best thing to do is to do an on-site and virtual library. So what do I mean? We're going to open up the Madison Square building, the place where the venue where we have our on-site sessions. And basically, walang lecture doon. Mag-aral lang kayo. Okay? Nandun yung mga MGs, some of the NGs, nandun some of the teachers. If you have any question, you can ask the teacher or the mother Luz. If you need counseling, they're also there. Okay? I'll make an appearance also. Okay? Baka mag-quiz tayo every once in a while na biglaan. Makaramdaman natin as we go along. But it's a place now for you to study. A place where you can see other people who have taken the med sports before study. It's a place where you can bond, that you can relate and tell each other experiences. A place for you to make friends. Okay? Doc, paano kung hindi kami repeater? Invited po ba kami? Pwede po ba kami doon sa on-site? Sa on-site library natin? Pwede guys, you're more than welcome to join. However, in the extreme case na Doc, napuno, we're going to prioritize pag napuno yung mga repeaters. Okay? But chances are, hindi mapupuno guys. Chances are, I think we'll have space for everyone. Even the on-site lectures, even if we gave you, di ba, parang registration sa day 1, day 2, day 3 ng mga on-site lectures. Guys, we actually have told you this. Kung, halimbawa, day 1 ka na-assign and you want to attend day 2 and day 3, paalam mo lang sa MG. Okay, sabihin mo lang na, Doc, pwede po ba ako mag-walk-in for the other remaining days? Wala kaming natanggihan, Doc. In-accept lahat yon. Kasi ang rule lang is basta bakante. Okay, kasi may fixed number of slots per day. So, as long as open, may bakante, pwede yung mga walk-in. Okay, kahit hindi sila registered for that day. Basta pinaalam sa MC. And we didn't turn away anyone. So, I expect here, pagdating dito sa on-site library natin, no one will be turned away also. Parang napaka-extreme sabi ko na may na mapupuno yan. Okay? First time to be conducted, experimental. Okay? So, titingnan natin, magbibigay ako ng proposed schedule. Halimbawa, 1 or 2 days po na, titimplahin namin. Pag konti lang pumunta, we'll stop. Pag marami pumunta, dadagdagan at dadagdagan lang natin. Okay? Yung mga on-site library sessions natin. So it will be from 8 a.m. to 6 p.m. It's a quiet place for you to study, yung actual venue natin. A place where you can meet other people. So it's in New Manila. We're also going to have an online version of this, just in case you're not from Metro Manila. Okay? And final advice, okay, at this point, okay, please utilize only the top-notch materials. Just go! Baka mawala kayo sa second reading na plano natin, tsaka dun sa pearls and buzzwords, pag minix and match niya yan with other institutions. It's not going to improve your grade, guys. If it would have improved your grades, we would have integrated parts of it. Halimbawa, the use of sketchy, the use of anatomy BRS. It would have helped. We would have utilized them already. Ina-assess namin yan with every batch. Feedback, SGD, surveys are conducted. So, nakaplano na yun sa top-notch. You stick with the top-notch program. Wala nang ibang review center, wala nang ibang handout, wala nang ibang review book, wala nang ibang textbook, wala nang sketchy. Tutukan nyo na lang itong materials natin, okay? Yung almost close to 100 pages na handout ninyo. Pag dumating pa yung pearls and buzzwords, guys, they will complement and give you the best possible chance for the med boards. Those who have mix and match materials, the feedback that we got is that it causes confusion kasi iba-iba yung mnemonics, iba-iba yung tingin na importante, iba-iba yung way to explain. Nagpo-cause ng confusion eh. I won't stop you, of course. You're free to decide what to do. If you decide, Doc, lahat ng review centers, lahat ng sketchy, lahat ng, even the textbook, titirahin ko, I won't stop you. But I can only give you my professional advice regarding this issue. Concentrate dun sa top-notch materials. Okay? It may not affect, mixing and matching the materials may not affect the particular subject, okay, that you use, halimbawa, micro or pharma, okay, or pedia, but it can affect the other subjects pag ginawa mo yon. Okay, so please utilize, based on my professional, personal advice, guys, only the top-notch materials. You're free to do what you want, of course, no problem there, okay, but based on what we've seen, based on the feedback of the students, just causes confusion, frustration pag hindi natapos both handouts, frustration pag hindi natapos yung both materials. Concentrate here. Okay? It will not be a 100%, Doc, nung ginamit ko yung handout, lumitaw lahat sa board exams. Mahuhula pa rin talaga kayo. A lot of questions in the med boards. But it will give you the best possible chance for the med boards. And it will give you a good preparation for the life after the med boards as a general practitioner. Okay? The Platinum books, the Surgery Platinum is about to be released. We're going to have it printed by this week or early next week. Okay, we'll keep you updated regarding that. So I'll give some notes about the mastery period and post it doon sa portal ninyo. We're also going to give you yung Excel na grading sheet. The one where you can place your score so far sa practice test, Quizmaster, diagnostic midterm finals for you to know whether you're improving or not. Sorry I took up a lot of your time. It's an introduction to the mastery period. Okay. CJ Cruzado will give you your Quizmaster. CJ, try to limit it to 30 minutes. All the Quizmaster sessions, Troy, please advise the MGs, try to limit it to 30 minutes. Ngayon lang medyo iba kasi nagbigay ako ng info sa mastery. After this, talagang Quizmasters na lang. Maraming salamat, everyone. If you have comments, feedback, suggestion, message me on Facebook. Diretso nila sa akin para maayos at ma-address. Okay, thank you so much.
Thank you very much, Doc Brolly, for having the intro to our mastery period. Now, for our quiz master, let me introduce you to him. I'm sure kilala naman na natin siya lahat. We have someone who is a graduate of Far Eastern University, Nicanor Reyes Medical Foundation, and also a top 6 of the October 2022 PLE. We have Dr. Christian Joseph B. Cruzado. Hi, Doc. Good morning sa iyo.
Hello guys, good morning.
Ayan. So first off, as usual, yung quiz master natin, I'm going to flash out the 10 questions. So you guys have like 30 seconds to answer each question. Kapag mahaba yung question, it's going to be 45 seconds. Now everyone take out your papers. Yeah. Please take out one part sheet of paper and number to 1 to 10. Charot. Para magka-quiz lang tayo sa high school. Okay. Anyway, guys, so here is your questions. So I'm gonna flash them already. So here's question number 1. All right, then question number 2. And question number 3. Then question number 4. Number 5. Question number 6. Question number 7. Question number 8. Here's number 9. And lastly, question number 10. And that's the final number. So I'll give the floor to Dr. Cruzado for his discussion, okay, for your quiz master Fisho 2.
Hello guys, let me just share my screen. Okay, let's start with question number 1. So all of the following statements are true of action potentials except, so the answer is, it's, okay. So the answer is letter C, ha? Because, let's check the other choices. In choice letter A, blockade of the voltage-gated potassium channels in a cardiac myocyte will lead to delayed repolarization. That's correct, guys. Actually, because your repolarization is mainly caused by your opening of your potassium channels. Therefore, pag in-inhibit mo yon, it will lead to delayed repolarization. Okay? And choice B, at the beginning of repolarization, the cell's equilibrium potential is closer to sodium ions than potassium ions. Actually, that is also correct. As you can see here, at the beginning of repolarization, like here, the cell's equilibrium potential is on the positive side, and it's more closer to the equilibrium potential of sodium, which is positive 65 millivolts. Okay? How about choice letter D? During the relative refractory period, a stronger impulse is required to generate an action potential. Choice letter D is correct because, remember, in the relative refractory period right here, lahat ng mga sodium channels dito pwede nang ma-activate. However, meron ka pa ring efflux ng potassium channels. Dahil dun sa efflux ng potassium channels mo, mas may hirapan ka ngayon mag-increase ng threshold or ma-reach ang threshold rather. Okay? So, the correct answer is letter C because as the stimulus, this is not correct, no, it is wrong because remember action potential is all or none. It does not depend on your stimulus strength. So, it also is not correct that the amplitude of the action potential gradually grows because your action potential is stereotype, no? So once na-reach mo na yung threshold, iisa ang itsura niyan, like here. Okay? So please remember your action potential. Okay? The characteristics of the true action potential, stereotypical size and shape, propagating, and all or none. Okay, next question. What type of membrane transport is involved in the movement of water through aquaporins in the collecting ducts of the kidneys? Okay, the correct answer is facilitated diffusion. Remember guys, you have your channels already or your carrier proteins. So pag may channels ka na, automatic eliminate mo na si simple diffusion because your simple diffusion is just simply the movement of substances across the membranes, particularly yung mga lipid-soluble substances and others like your oxygen, nitrogen, carbon dioxide, and alcohol, and your anesthetic drugs. How about your osmosis, guys? Remember osmosis, it is the movement of water through the membrane only. Membrane, it does not involve the use of your channels or carriers. How about primary active transport? Okay, primary active transport, guys, remember, mainly, ang gumagamit niyan, yung mga sodium potassium ATPase pump, hydrogen potassium ATPase pump, and calcium ATPase pump. Okay, it does not involve the transport of water. Okay, so the best answer here is facilitated diffusion because it involves the use of your carrier proteins and your transporters.
CJ, go
Ah,
back.
yeah. Okay po.
Correction lang dito kasi natanong na to dati sa board some similar question. The correct answer to this question is actually osmosis. Ang water channels, ang aquaporins mo ay water channels. Okay? Yung channels na tinutukoy mo rito does not involve the use of channels or carrier proteins. You're referring here to ion channels. Aquaporins is where water will pass through. Okay? They were called water channels because they allow water to go in or out in terms of osmosis. Ang water cannot penetrate the cell membrane directly because fat and water do not mix. Oil and water do not mix. Your lipid bilayer okay, will not allow water to directly penetrate. So instead, they will have to utilize osmosis for transport. Ito naman yung sa facilitated diffusion, okay? Glut and amino acid transporters, that's correct. But hindi niya minention yung sa transport of water. Kasi yung transport of water, Doc, sa ano yan, aquaporins. So I don't know, probably you got this from a textbook or review book. Does not involve the use of channels or carrier proteins. Yung channels dito referring to ion channels.
Okay
Pero
po.
yung aquaporins, water channels, nag-aalaw siya.
Okay po, Doc.
So, ano na natin to. Pasensya na, I have to move in at baka matanong
Sige.
ulit sa exam, may tinanong dati similar to this. Pasensya na to.
Okay po. Noted po, Doc. So, osmosis, the correct answer as explained by Doc Broly. Thank you, Doc, for that feedback. So, just remember, guys, your cellular transport, types of cellular transport. Okay, for sure na-explain na sa inyo ni Doc Broly to, guys. So, just remember, yung types of carrier-mediated transport and non-carrier-mediated transport. Next question, which characterizes the dominant muscle fiber present in swimmers? So the correct answer here is letter D. Because guys, swimmers requires endurance, okay? So, ang dapat na muscle fiber na dominant sa kanila is your type 1. All of the other choices describes type 2, okay? Okay guys, your type 1 and type 2 muscle fibers must know to. So just remember yung mnemonic, no? Type 1 wants low red ox with a perfect posture. Okay? Type 1, red. Okay, red in appearance. Predominant metabolism is oxidative phosphorylation. It has a high amount of mitochondria and myoglobin as compared to your type 2. Okay, the type of training is endurance training and examples are postural muscles of the back. Meanwhile, in type 2, you have your white and predominant metabolism is anaerobic glycolysis. Okay, less mitochondria, myoglobin. Okay, mainly used for resistance training and your sprinting. Examples are your extraocular muscles. Next question. When receptors of the autonomic nervous system are stimulated, specific effects occur. Which receptor and effect pairing is correct? Okay, majority of you got the correct answer. Very good, guys. So the answer here is letter B. Dog. Uterine relaxation. Beta 2, uterine relaxation. Okay, so for choice A, so your vasodilation is mediated by your beta 2 receptors. Meanwhile, your bronchoconstriction is M3. Your renin release is your beta 1. Okay? Okay guys, important tong table na to. Tatanong to sa board. So please remember this, ha? Next, during which phase of the cardiac cycle does the T wave appear on an ECG? Okay? So majority answered letter C, no? Okay, gets ko naman. But remember guys, yung T wave, it would represent, no, ventricular repolarization. Therefore, remember in the cardiac muscle, an electrical activity would occur first before a certain contraction or relaxation would happen. So therefore, ang electrical activity muna ang mangyayari bago mag-relaxation. So anong phase dito sa cardiac cycle ang bago mag-relaxation? Ang sagot ay ventricular ejection. Okay? Letter B. Okay guys, wag maglilito ha kasi yung mga electrical activities sa heart ang mag-i-initiate ng relaxation ng ventricles, particularly your T wave. Okay guys, as you can see here, no, your T wave occurs at your ventricular ejection, particularly in the reduced ventricular ejection phase. Okay, kung titingnan din natin, your P wave that represents atrial depolarization, it would occur before the onset of your it would occur before the onset of your atrial systole. Ganun din, no, nauuna muna yung electrical activity bago yung contractility or relaxation, as well as your QRS.
Dagdag ko lang, Dr. CJ, tama yung sagot mo dito.
Okay.
Ang nabibigay ko kasi na-emphasize ko sa lectures ko to the student is that the T wave, the isovolumic relaxation phase is preceded by the T wave. So I think yun yung nagiging cause ng confusion, kaya letter C yung sinagot ng karamihan. Tingnan mo yung letter C, isovolumic relaxation yung sinagot nila, no?
Yes po, Doc.
In isovolumic relaxation, remember yung comment na nandun sa handout nyo, it is preceded by the T wave. So dito ang tanong ni CJ is kailan nakikita yung T-wave? So before isovolumic relaxation. So kailan yung before isovolumic relaxation, Doc? Yung ventricular ejection. Okay? Yung I think reduced ventricular ejection phase. So be careful. Yan yung mga context, yung reading context, reading comprehension, importante. Okay? Preceded by T-wave, meaning before the isovolumic relaxation, doon nangyari yung T-wave mo. Kailan nag-appear yung T-wave? Before isovolumic relaxation. Anong phase yung before isovolumic relaxation? Reduced ventricular ejection. Okay? Sige, continue CJ. Thank you.
Thank you po, Doc. Okay, next question. A 20-year-old male with moderate bronchial asthma exacerbation is tachypnic with a respiratory rate of 27. What can be said about his chemical control of respiration? So the answer here is, okay, so majority naman answered letter B, okay, and letter C. But guys, remember, the correct answer here is letter A. The respiratory center is stimulated more by blood CO2. Okay, remember, blood yan ha, blood CO2 than blood H. Why is letter B wrong? Because ang mali dito, it should be blood O2 levels. Okay, your chemoreceptors, particularly in the carotid bodies and aortic bodies, are stimulated by your blood O2 levels, not blood CO2. How about letter C? It is caused, the stimulation of your chemosensitive neurons is primarily caused by an increase in H plus or a decrease in pH. Okay, it's not PaO2. How about letter D? A decrease in blood greatly stimulates, a decrease in blood pH greatly stimulates his peripheral chemoreceptors. This is wrong. Again, your peripheral chemoreceptors is stimulated more by your blood oxygen levels. Okay, so A ang correct answer. So guys, wag lang malilito ha. Okay, sabi kasi dito, blood CO2. Kasi guys, ang sabi sa guide, your blood CO2 is more permeable than your blood H. Okay? Pero kasi yung blood CO2 mo sa blood, pag nakarating na yan sa CSF and the interstitial fluid, magiging blood H din yan. And din yung blood H mo, yung magsistimulate directly to the medulla or the chemosensitive neurons in the medulla. So just remember, no, yung mnemonics natin, your central chemoreceptors mainly response to CSF-H+, or stated in other way, a low pH levels in the CSF, and this is caused by a high PaCO2. Meanwhile, your peripheral chemoreceptors, okay, pang low oxygen, okay? So mainly responds to your low oxygen levels. Okay, next question. A patient with chronic kidney disease caused by diabetic nephropathy was given a medication that inhibits the sodium glucose cotransporter 2 in the proximal tubules. This medication leads to the activation of which renal autoregulatory mechanism to control renal blood flow? Again, guys, very good guys kasi nakuha niyo yung correct answer, majority of you. So the answer here is tubuloglomerular feedback. Remember guys, okay? Pag in-inhibit mo si sodium glucose cotransporter 2, ito siya, nandito siya sa tubular side ng renal cell, okay? And then pag inhibit mo to, you inhibit na reabsorption of your glucose and sodium, leading to a hypertonic urine. Okay? So ang lalabas kasi dito, hypertonic urine. So alin dyan yung stimulus ay hypertonic urine. So it's your letter B. How about your myogenic autoregulation? Yung myogenic autoregulation dyan, it mainly responds to the stretching of your smooth muscles in the afferent arteriole. So mainly, ma-increase in BP yan. And it will lead to contraction of your vascular smooth muscles. Okay? Kasi kailangan niya pababain yung BP, kaya kailangan mag-contract ulit. How about your renin, angiotensin, aldosterone system? Okay? Yung triggers niyan is renal hypoperfusion, decreased sodium delivery to the macula densa. Okay? So ano yun? Hypotonic urine. So hindi naman ito yung case na to, which is hypertonic. And increased sympathetic tone. Okay? How about the glomerular-tubular balance? Well, kailangan nyo alamin sa glomerular-tubular balance, it's just that an increase in GFR causes an increase in the reabsorption of solute. So parang in-increase ko yung filtration, then in-increase ko rin yung reabsorption, and consequently water. Okay? Primarily happens in the proximal tubules. Okay guys, remember, inhibition. So ano nangyari dito? You increase the salt and fluid delivery to the distal tubule. So leading to a hypertonic urine. So ano mangyayari? So magkakaroon ng adenosine secretion leading to vasoconstriction of your afferent arterioles decreased capillary pressure, and decreased GFR. Okay? Remember guys, adenosine in the renal vasculature is vasoconstriction yan ha. Kasi di ba adenosine in other blood vessels, vasodilation yan. Naiiba lang siya sa renal vasculature. Also guys, remember na IM correlation, no? Your SGLT2 inhibitors, just like in this question, okay, slows the progression of your CKD via the activation of this mechanism of their tubuloglomerular feedback. Kaya very beneficial sila because it stabilizes the GFR. Okay, number 8. A woman with retrosternal pain and regurgitation of previously ingested food is diagnosed with gastroesophageal reflux disease. Which gastrointestinal tract motor activity is mainly affected by this condition? Okay, very good guys. Lahat kayo, most of you answered letter C. So the correct answer here is letter C, or tonic contraction, because in gastroesophageal reflux disease, sinabi na may regurgitation. So there's a problem in your lower esophageal sphincter. So yung mga sphincters natin, they are mainly controlled by your tonic contraction. Okay? Let's check the other choices. No? So peristalsis, this again is for propelling food. No? Pag sa esophagus, it propels food towards the stomach. Pag intestine, it propels chyme, okay, towards the large intestine. How about, again, yung tonic contraction, mainly present in the sphincters. Segmentation is just a back and forth movement. Ha? It mixes the chyme with pancreatic enzyme. So parang mix ka lang dyan. Meanwhile, yung migrating motor complex, it happens during fasting and occurs at 90-minute intervals to clear the stomach of your residual food. Again, yung migrating motor complexes is, smoothing is the mediator of these contractions. Which is not an action of cortisol. Okay? So, ano sagot niyo dyan, guys? So, okay, majority answered letter B. But guys, I want you to recall in biochem, cortisol ba, ano ba siya? Glycogenesis ba siya or gluconeogenesis? Diba naalala niyo sa biochem, your cortisol is a gluconeogenesis. So therefore, kung gluconeogenesis, it facilitates gluconeogenesis, nag-increase ba siya ng utilization of glucose in adipose tissue? Of course not, because it should decrease the glucose utilization. Okay? So it inhibits bone formation. Of course, your cortisol does that. Kaya yung mga patients na naka-long-term steroid therapy, at risk sila for osteoporosis. It maintains vascular responsiveness to catecholamines. Of course, kaya di ba yung mga refractory shock sa hospital, binibigyan natin sila ng hydrocortisone. Yung mga hindi nagre-respond sa norepinephrine, hindi na nagre-respond sa vasopressin, binibigyan natin sila ng hydrocortisone because your cortisol maintains vascular responsiveness to catecholamines. How about stabilizes the lysosomal membranes? Okay, kung titingnan nyo, stabilizes the lysosomal membranes. That is just like an anti-inflammatory activity, no? So, choice D is also correct. Okay? So, remember the action of your glucocorticoids, so stimulation of gluconeogenesis. Okay, anti-inflammatory, suppression of immune response, and maintains vascular responsiveness of catecholamines. And also inhibits your bone formation. Last number, a patient diagnosed with rheumatoid arthritis presents with an elevated erythrocyte sedimentation rate. Which cytokine causes this laboratory finding? Okay, very good. Lahat kayo, almost all of you got the correct answer, no? So the correct answer here is letter C, interleukin 6. So, okay, your interleukin 6 kasi, it is a main inducer of acute phase reactants, okay? And one of your acute phase reactants is fibrinogen. And fibrinogen will coat the RBCs, leading to increased aggregation, and the RBCs fall at a faster rate, hence an increase in ESR. Okay? What about the other choices? Okay, interleukin 8, guys. Ang natandaan nyo dyan sa interleukin 8, it induces neutrophil chemotaxis and degranulation. How about interleukin 1? When it's a pyrogen, it induces fever. Interleukin 4, differentiation. Okay guys, interleukin 4 is important kasi tatanong siya. Natandaan nyo ba sa IM? Okay? Saan to ginagamit yung interleukin 4 receptor antagonist? Sa asthma, di ba? Okay? Because your interleukin 4 facilitates the class switching of your IgE. In asthma, you have high IgE levels, no? So interleukin 4 receptor antagonist mainly used in asthma, particularly in your step 5 na siya, nasa step 5 na siya ng GINA guidelines. Okay? So don't forget your interleukin 4, differentiation of your T helper cells to T helper 2. Okay? And class switching of your IgE and IgG. Okay guys, ito yung table sa handout ninyo. But just remember, okay, marami dyan kalang kapsaduhin. But I want you to remember guys, yung mga nasa choices dito kanina, and also interleukin 2. Your interleukin 2, proliferation and differentiation of your T cells and activation of macrophages. Okay, interleukin 2. Okay, your interleukin 5, differentiation of eosinophils and class switching to IgA. Interleukin 5, guys, okay, naalala nyo sa asthma ulit yung ginagamit. Okay, and then, among the immunosuppressants, I want you to remember the transforming growth factor beta. Okay, and also, wala dito, guys, your interleukin 3 stimulates proliferation of your granulocytes and stem cells, and interleukin 10 is also for immunosuppression. Okay, guys, I hope you learned something today, ha? Okay, thank you po.
Ayan, thank you Doc CJ for your Quizmaster. So that ends yung Quizmaster 2 session natin. So Doc Roy, do we still have more announcements for our students?
Maraming salamat CJ, very good work. Take note that the answer key and the explanation video, okay, ayokong tawagin ratio, masakit sa tenga pag nahilig ko yung term na ratio. We call it explanation video for your midterm exam is already posted. Pinagatian ni Dr. Carl Avilo at ni Dr. Gabby Flores yung exam discussion. So options, Doc, anong gagawin namin pag natapos ngayong may midterms exam video na tsaka handout? You have the option na basahin na lang yung explanation ng handout or panoorin yung explanation video. You also have the option na isang 4 to 6 hour chunk na dire-diretso panoorin mo yung video, basahin yung handout, or i-piecemeal mo na 20 at a time. Probably, if I were in your position, if you're the average top-notch student, on day 2, by the time that you do your practice test 3, isabay mo na, silipin mo na ngayon yung either video or yung handout for that particular subject. So 20 questions lang yon coming from the midterms. Or kung gipit talaga sa oras, another tactic that I will do is probably panonoorin ko yung video lecture and the handout ng midterms after the finals. Okay, parang siya na yung after the finals, doon ko na pagsasabayin yung finals video discussion, handout. So doon ko na siya tututukan. Isang straight block na lang, pero after the finals. For now, magfo-focus na muna ako doon sa handout na second reading, tapos doon sa Quizmaster at sa practice test 3. Okay? So yun yung recommendation. May mga nag-message na sa akin, guys. May orientation lang kami to top-notch Genesis for the clerks interns. I'll address your messages after 1 p.m. after lunchtime. Okay? Titirahin ko yan. Okay, mag-alagay. Sasagot ako. Okay? Sulitin nyo. Yan yung susulitin yung bayad ninyo. Yung mga counseling for the mentors, MGs, and me. Okay? Especially academic advice on how to study, okay, and how to handle everything that's happening right now. Pagtulungan natin. Good luck. God bless. Thank you very much, Troy. Thank you very much to everyone.
Thank you very much, Doc Broly. So before we end our live session, guys, pampasaya rin ng buhay. Since Burmans na tayo ngayon, how about a little treat for like a Christmas carol? Diba? Sige, push natin ito mga B.
Kumukuti-kutitap, bumubusi-busilak, ganyan ang indang ng mga pamilya. Kikindat-kindat, kukurap-kurap, pinaglalaroan ng iyong mga mata.
Kumukuti-kutitap, bumubusi-busilak, ganyan ang kurap ng mga bituin. Tumitibok-tibok, sumisinok-sinok, koronahan ng palarang bituin. Iba't ibang palamuti, ating isabit sa puno. Ubusan ng mga kulay, tangmakan ng mga regalo. Tumitibok-tibok, sumisinok-sinok, wag lang malundo sasabitin. Pupulupot-lupot, paikot ng paikot, koronahan ng palarang bituin. Iba't ibang palamuti, ating isabit sa puno. Ubusan ng mga kulay, tangmakan ng mga regalo.
Sino-sino, huwag lang malundo sasabitin. Pupulupot-lupot, paikot ng paikot, koronahan ng palarang bituin.
Dagdagan mo pa ng candy.
Ribones, koses at guhitan, habang lalong dumadami, regalo mo'y dagdagan. Kumukuti-kutitap, bumubusi-busila, ganyan ang lindang pamilya. Kikindat-kindat, kukurap-kurap, pinaglalaroan ang iyong mga mata. Kumukuti-kutitap, bumubusi-busila, ganyan ang kurap ng mga bituin. Tumitibok-tibok, sumisinok-sinok, kanahan mo pa ng palarang bituin.
All right, guys. Once again, thank you very much for attending your introduction to your mastery period and your Quizmaster 2 session for physiology. Good luck, everyone, during your mastery period. If you have any problems, please contact us, your MGs, or even contact your mentors. Have a great day, everyone, and happy aral! Ingat!